Hi, I'm Tim. I'm a sports and holistic therapist, and I'm here with my colleague Holly to show you how to use the TEND device on painful forearms and elbows. The muscles in the forearm feed up into the bones on either side, the lateral and the medial epicondyle, and you can get a condition that's known as tennis elbow, when you've got tension in these muscles that get very tight as it comes and joins at the bone. The same thing on the forearm, the tension comes up through the forearm to the bone where it joins here. So we're going to use the TEND device to help loosen up these muscles and get rid of some of the tension that sits there that's causing the pain in the first place. So I'll turn the device on, first setting. The easiest way is just to actually feel across the arm. I can see with Holly she's really tight there. So I'm going to start around that area but not directly on it. So we're going to move into the muscles that work towards that tight spot, gently up the arm. And I can even feel with the TEND it's just a little bit tighter there, so I'm going to work around it for 10 to 15 seconds and just get the muscles to start relaxing and responding to the light vibration. As it softens, I can feel the TEND slide a lot better through the muscle, and I can see that it's softening. So I can turn that setting up, use it a little bit higher, and just get the muscles to normalise this vibration sensation, and the muscle will then start to gently relax. Because we've got tension up into the bone, we can work right up in the top end of the tendon, but obviously avoiding the bone itself. I personally would just put my thumb over the top just to protect that area and work gently through the tendon area, just stimulating the blood flow underneath and then back down into the muscle again. Where there's a particularly tight spot that I identified earlier, it has settled a bit, but I would turn that onto the pulse setting, which means I can hold it right into that very specific spot and it will send a nice pulse into the muscle. You don't need to move the TEND very much, but equally you can just slide it through there. And it's normalising that nerve sensation that causes the pain. We can do exactly the same if I put it back onto the first setting on the inside and work through, find the tender areas and just gently massage towards and around. And you'll sometimes see that the muscles will tighten a little bit as you go over and the hand will move or the fingers will tighten. That's perfectly normal, that's just the muscles and tendons that make that hand move as it does. So by relaxing it, we can work through the muscle and keep that tissue soft in there. And that's how you would use it on the forearm to deal with tennis elbow, golfer's elbow and the like.